Hi, everyone. I'm Gary Berman, host of the Cyber Hero Adventure Show. We have the next in our five-part series, a great interview with Beau Woods from CISA. Hey, Beau, welcome back to the show.
Hey, Gary, happy to be back.
Thanks so much for being here. And for our audience who may not be familiar with CISA, maybe you can give them a little bit of background about your mission in general and critical infrastructure in particular.
Sure. Yeah. So CISA is kind of the newest kid on the block in the federal agency scene. Stands for the Cybersecurity and Infrastructure Security Agency. We were stood up in 2018 to have kind of a focused look at defending the nation's critical infrastructure and national critical functions. Those things that we do as a nation to keep us going. We look at both as should be kind of uh, obvious from the name, cybersecurity, the bits and bytes, and then infrastructure security, kind of guns, guards, and dogs, as we say. So that was one of the things that really attracted me to CISA, and one of the reasons why I joined one of the innovative programs that they've got to bring on people from the private sector, from the cybersecurity researcher community, into CISA for short-term stints in order to help defend the nation.
Indeed. And when you and I met several years ago, it was pertaining to an incredibly important sector, healthcare. So maybe you can kind of set the table to help our audience understand the complexities of healthcare cybersecurity and some of the attack vectors, such as ransomware.
Yeah, sure. So healthcare is a huge sector. I actually started my career working for a small healthcare delivery organization, small hospital group. And one of the things that I really quickly learned is, on the one hand, I wanted to bring in all the blinky lights and do all the technical things that are going to keep data safe and keep the infrastructure safe. And meanwhile, the leadership was saying, yes, but that same, a couple $100,000 could get us, more physicians, more nurses, more clinical equipment, so that we can better serve our patients. And so that pretty quickly taught me that these trade-offs are really hard. They're really not straightforward. And in some of my work with medical device makers through DEF CON, the biohacking village, through the FDA, where I spent a similar 1 year term with them, um, it just becomes increasingly clear that those trade-offs are non-obvious, and that we need to maybe do a little bit more as a nation, as a community, to help those organizations defend themselves. And so that's one of the things I'm really proud at working with at CISA.
Indeed, and this is a matter that is literally, in some cases, life and death. I mean, if what one would think about the importance of digital medical records or intake in an emergency room,
Mhm.
pharmaceutical compliance. I mean, maybe you can unpack that a little bit for our audience.
Yeah, absolutely. I mean, you've got many things that you're looking to protect in healthcare. There's the kind of traditional cybersecurity concern for data protection, confidentiality, integrity, availability of things like patient records, of patients' credit card numbers, of the personal information of the doctors and nurses who are working there, or the other non-clinical staff. But also, on the other hand, you have something really unique to healthcare, which is that in healthcare, it's really patient safety on the line. It's effectiveness of these treatments and these therapies on the line. And whether you're looking at a technical system that has gone down or has been tampered with, the real effect, and the thing that I care most strongly about, is ensuring that human life and public safety continue to be protected, and that doctors and nurses and clinical staff can continue to have the best tools available to them to really save people's lives. That's what it's all about. And that patients will take advantage of the best capabilities that we can bring to bear without fear that those could become hacked.
Indeed. And in a future segment, after we discuss ransomware, we're going to talk about the COVID-19 task force that CISA has set up, including some very interesting challenges pertaining to distribution of the vaccine, cold storage, and things like that. But in the meantime, one of the most insidious attack vectors is ransomware, where criminal gangs and threat actors are holding hospitals and organizations throughout the healthcare ecosystem essentially hostage, and that has tremendous life and death implications, doesn't it?
Yeah, absolutely. When you think about kind of the traditional crimeware and criminal motivation, you think about criminals trying to extract data from organizations in order to take advantage of that information that they pull out. With ransomware or with some of these extortion attempts, um, the ransomers, the criminal groups, are actually shutting down operations and using the inherent value of the systems and the business processes, the business models, in order to extract value from organizations. Or they're also pulling down information and threatening to disclose it to the world unless people pay for it. So, this is really a new type of threat that's been developing over the last decade or so. And has really come to prominence, particularly within healthcare, as well as state, local, territorial, tribal, and schools within the past 5 to 6 years. I think the first high profile ransomware attack against healthcare that I remember was one in January 2016. So this is 6 years on now that it's been. I guess healthcare has kind of been on notice that it can impact patient care.
And would that have been anything to do with WannaCry?
That particular one was not WannaCry. WannaCry was later in, I think that was 2017, and then we had NotPetya later on in 2017. But as both of those global ransomware events showed, uh, criminals could intentionally or inadvertently shut down quite a lot of organizations with just the click of a button and some automatic propagation across the internet for some of these systems.
Indeed, and it's bad enough that a system would be held hostage. However, there's no guarantee that the data won't be exfiltrated, and in fact, probably was, and then maybe even leaked anyways to do our nation harm. Is that a fair assessment?
Yeah, in a lot of cases, this is what we call kind of double ransomware or triple ransomware in some cases, where the criminal groups will not just lock up an organization and prevent them from operating normally, but they'll also extract a lot of the information, pull the data down, and hold that for extortion from these organizations to say, look, I'll release it either to the public if you don't pay me, or I'll start going to your customers and threatening to release your customers' information individually unless the customers pay. And there's some other insidious wrinkles to ransomware, but essentially these criminal groups have determined that they can make quite a good profit off of attacking organizations through something that we 10 years ago wasn't generally thought of as a credible threat, and today it's one of the biggest that we face in the nation.
Indeed. And what resources does CISA have available, for the healthcare ecosystem to help protect
Yeah.
themselves?
Yeah, so actually, CISA coordinated a whole of government kind of a one-stop shop for information on ransomware called stopransomware.gov. And stopransomware.gov has a lot of tips, a lot of advice and guidance and capabilities for organizations to plan for and prevent ransoms from happening, as well as to more quickly respond and recover from ransomware, including some dedicated tips for hospitals. For instance, we published a few months ago a incident response guide for ransomware in hospitals, and the idea is it's a very simple one-page document where it just helps them go through before an event happens and do some planning, do some preparation to fill in some of the critical contacts. So if their systems are locked up and they can't find, for instance, their incident response team's contact information, they've got it on this single piece of paper that they can literally just tape to their wall, put sticky notes on each of these places. And it helps them structurally think through some of the things that they'll want to know, want to prepare before something like this happens.
Indeed, and a more structured way to go about that are referred to as tabletops.
Yeah.
Maybe you can share with our audience the benefits of those.
Yeah, absolutely. Tabletop exercises are great for organizations to really test what would happen. A lot of organizations create plans; they do planning exercises, and this is kind of the companion to that. So we've done. I've done several tabletop exercises with healthcare providers, with other types of organizations to help them think through this in the case of ransomware, because ransomware uh, tends to manifest in ways that are less familiar to people than some of the traditional cyber criminal attacks that we've looked at and become more comfortable with over the past few decades. It helps to run through this, right? So in doing that, the organizations tend to have several high impact discoveries when they're going through, no matter how good their plans are, because as you're testing these things, you find stuff that wouldn't have come out ordinarily in your planning phase. So tabletop exercises can be a great way to go through that. And CISA has some resources on how to run tabletop exercises. We've done wide scale tabletop exercises in particular regions, or we can also do tabletop exercises and help facilitate those for organizations or other groups.
Think about sort of the irony that something like the healthcare system, you're going back to paper and pencil, to fill out
Mhm.
forms, and but even something like voice over IP, isn't it important? Like you said earlier, I think you were sort of half joking about posting something on a wall. However, it is important to have as much in physical writing, maybe even off premise or something like that, uh, as a backup, right?
Yeah, absolutely. And Gary, I thought we agreed that you were going to be the joke teller, and I was just going to be the kind of straight truth.
Oh,
Um,
is that a backhanded compliment? Like it sounds like look, I've listened and learned from hundreds of people, so I know a little bit about many things, but nothing, in depth. But I'll tell my wife you said that, on behalf of a grateful digital universe. Thanks for what CISA does, and for who you are and what you do, and most importantly, why you do it. And we're stronger together. That's a flat out fact. How does our audience get more information from you?
Yeah. So for ransomware, you can go to stopransomware.gov, which, as I said, is kind of the one stop shop for a lot of the capabilities, services, advice, and guidance that the whole of government can provide to organizations before, during, and after a ransomware event. Or go to CISA.gov, which is our primary government website. In addition, you can go and work with some of the great folks that work on behalf of CISA out in your regions very close to you.
Indeed. Well, again, thank you so much, Beau, to you and all of your colleagues at CISA, and for our audience. I hope you enjoyed this amazing series highlighting some of the great work that CISA's done. Make sure to get in touch with them. When smart people get together, good things happen, and CISA is a great example of that. So stay tuned for our next episode, focusing on the COVID-19 task force.